Dr. Darren Schmidt. I spoke to you in July in DC. I've focused on nutrition in my practice, my private practice, for 23 years at the Nutritional Healing Center of Ann Arbor. My clinicians and I have seen 60,000 nutrition visits in the last 5 years. I want to tell you about my patient, Yael Rosner, a former Miss Israel, who had been struggling with her health. She says to me, "I must admit that I was sure I was eating healthy since I was following the U.S. food pyramid. I became pre-diabetic, got neuropathy in my feet, hypertension, overweight, and bloating. When he had me switch to a low-carb diet, I started to sleep better and longer, my feet stopped hurting, my blood pressure dropped 20 points, and my blood glucose dropped 40. I'm losing pounds and people are complimenting me and I'm happier." So I'm not surprised at this. I've had thousands of patients over the years have great results with the low-carb diet. Jeremy Martin had spondylitis for 10 years. Painkillers ruined his gut. He took Cipro, which destroyed his tendons and nervous system. Years of eating high-carb foods was his cause, and now with the low-carb diet, he's off all medications, pain-free, down 60 pounds, and he's smiling again. These patients switched their diet to the opposite of the current dietary guidelines. Why is there such a discrepancy between the guidelines and these great results? Well, let me explain it like this. Do you remember the 6 steps of the scientific method that we all learned in grade school? Here they are. Step 1, make an observation. Step 2, form a hypothesis. Step 3, test that hypothesis with an experiment to see if it's actually true or not. 4, analyze the data, then report the data, then other scientists have to replicate it. Epidemiology is only the first 2 steps out of 6. It is certainly missing the experiment. Therefore, it is an incomplete scientific process. It is mostly just survey. This includes the Blue Zones, Loma Linda, Seventh-day Adventists, Epic Data, Okinawans, Eskimo, and NHANES. It is your charge by the law that you have to use the preponderance of science. It takes all 6 steps of the scientific method to qualify as science, not just the first 2 steps like in an epidemiological survey. The majority of your studies you're using are incomplete regarding the scientific method. Therefore, they are not science and need to be discarded per the jurisdiction of the law that you're operating. We need diversity in the guidelines. There's no one diet for all. The low-carb diet has to be an option in your report, just like the American Diabetes Association did. There are 100 clinical trials, experiments, actual science, that proves the low-carb diet is safe and effective. Please add at least one line in your report that says a low-carb diet of 25% or less of calories from carbohydrates is a safe and viable option, because it is. This is your opportunity to reverse 40 years of non-scientific guidelines and to be true scientists to finally solve our nation's health problem. And please don't make me have to come back in 5 years to repeat myself. Add the low-carb option now. Thank you.
Thank you.